Alors, bonjour à tous, bienvenue à la conférence de presse.
Hello, everyone, and welcome to this press conference. The Deputy Premier of Quebec, Minister of Public Safety, is together with the Social Services and Health Minister and the Strategic Medical Advisor to the Regional Public Health. Ms. Guilbault, the mic is yours. Yes, thank you so much. So hello, everyone, and thank you for being here. Welcome to this update on the situation having to do with COVID-19. So with the numbers of the past few days, which I'm sure you've followed on a daily basis that are now available through, for example, my colleague Christian, you can see that the situation continues being under control in Quebec. We have an increase in the number of daily cases, which is relatively stable. We also have a good amount of leeway in our hospitals, and we of course continue following with a lot of attention the entire situation and evolution of the contagion. We last week went above our daily testing capacity objective, which means that with this very significant screening effort, we should be able to detect an upsurge in contagion or any worrisome movement. We would be able to react very quickly because of the fact that we can have that portrait in real time, thanks, amongst other things, to our screening capacity. Nevertheless, we are observing a trend that is worrisome in our young people from 15 years of age to 34 years of age, with outbreaks, amongst others, in bars. We talked about it, but also in private parties, if you'll allow me to say that. So private gatherings, parties that young people are having together, and also in certain sports and social activities. So those young people from 15 to 34 years of age, we can see that trend in that age group, and it worries us. It worries us for two reasons. The first being that these young people, even if they don't develop the disease themselves or if they are asymptomatic, they can become transmission vectors for people who are more vulnerable than themselves. For example, a young person might contaminate their parents or grandparents, and the parents or grandparents would develop the disease and might end up in a health situation that would be difficult. This is something that has been already seen, this kind of contamination, and we want to avoid this kind of contagion at all costs between children and their parents or grandparents. So that is the first element why this worries us. The second is the health of the young people themselves. Young people also can suffer of COVID-19. Of course, the mortality rate is a lot less significant in young people if we look at the data, but it would be false to believe that young people are immunized against COVID-19 or that there is no risk of complication for young people. Yes, young people don't die as much of COVID-19, but they can also have longer-term consequences. So please, let's be careful. I speak specifically to those from 15 to 34 years of age. Believe me, you don't want to end up in a hospital center in ICU, especially in intensive care for those who might develop the disease. It's not fun to end up in intensive care. And we ask you to be prudent. That is the reason why my message today, I want to center it by making a call out to young people, to call out to the young people from 15 people to 34 years of age. Mobilize yourself. Mobilize everybody around you, your friends, the people that you hang out with. I ask you to mobilize yourself to respect the public health guidelines, because as I said, we are observing a trend. There's a very significant proportion of the new cases every day that affects that age group, the 15 to 34 years of age. So right now, you have the power in your hands, literally, to influence how things go on and to make it that the situation remains under control. So it's not power to be taken lightly. Please use it correctly. It's not every day that we end up having so much power in our own hands. So I ask you to become influencers with the people around you, with the people that you hang out with. If you see young people, or even not young people, regardless who it is, who don't respect the guidelines of public health, please remind them that you have to remain at a distance, that you have to wear the face covering. Become yourselves champions of distancing and wearing the face covering. We all understand that you feel like going out, you feel like seeing your friends, and it's quite understandable. I myself was in that age group really not long ago, and I understand that one can want to to live again. It's summer, we've got time off, and it's confinement is over. And it is possible to do it, but we just have to respect the guidelines. 10 people or less, wear the mask if it's not possible to keep 2 meters, but keep the 2 meters. Avoid wearing, sharing a beer or food or touching or, kissing. All of that puts you at risk, and it explains why there is an upsurge in the cases in the 15 to 34 age group. So I ask you to please participate in this collective effort. You have that power in your hands, as I said so. We have to be all together against COVID. And right now, you are the ones that have a great part of that power to protect society in your hands. So please seize it, take it seriously, and accept the challenge that we're giving you to become the champions of respecting the guidelines, and also to help others respect them as well if some are tempted not to. Another important element, amongst others for young people, but generally speaking, is to get tested. It's very important. I talked about it as an introduction, and we went beyond our capacity for the daily testing capacity. So we're fully capable of testing anybody who comes to get tested. We are able of testing at night, in the evening, with or without appointment. There are clinics in all the regions of Quebec. So if you have, of course, symptoms, go get tested. But if you hear that maybe there was somebody who had symptoms around you or who tested positive in a place where you went, if you have any kind of doubt, then go get tested. Be proactive. Don't necessarily wait, to get a call from public health that says, well, in such and such a place there was a case. If you were there, go get tested. Be proactive. And if you have any doubts, go get tested. We have a lot of capacity to do so. And I also want to say a word on certain unfortunate behaviors that we saw in certain touristic areas in Quebec, including the Gaspésie region. I'm sure that you've seen the images and the things that people wrote about that in the past few days. I would like to start by reminding you all and reminding all of us that we are extremely happy to see so many Quebecers traveling within Quebec this year. One of the consequences that is positive of COVID, if there are any, is that touristic opportunity that we were talking about in the spring, and that has become reality here. People are traveling all over Quebec. They're discovering regions where perhaps they had never been, campings, campgrounds, cottages. We're really happy about that Quebecers responded to that call. It allows us to have good economy in our region. So there are very, very positive aspects to that. It makes us happy. However, there is a minority of tourists who seem to have forgotten what respect is and what politeness is. When I see those images, I find it shocking to see. I find that it's heartbreaking to see images such as we've seen, people who leave litter on campgrounds, on beaches, even sometimes, in water streams. That makes no sense. If we want everybody to be able to enjoy summer and tourism and their vacation in all safety and with, cleanliness, I ask that minority, once again, it is a minority of people who have been a bit excessive in their behavior, to be careful, to show, respect for other people in society. It's not fun for people who travel to those places and for the people who live there. So please, if we want to be able to enjoy Quebec, we have to preserve our territory, the cleanliness, the quality of our territory. So please be careful for everybody. I'd like to come back now on the on the guidelines of public health, together with another element that probably shocked a lot of people as well in the past few days, and rightly so. I'm talking here about the anti-mask protests that took place over the weekend in Montreal and in Quebec. We saw during those protests images of protesters who were not respecting physical distancing, who were not wearing face coverings, and who expressed themselves and going against the efforts being made right now to protect our health. So I was particularly shocked, and I'm probably not the only one, but I really was very shocked to see that some people allow themselves like that to transgress the rules of public health and allow themselves, on top of everything else, to insult journalists, to insult the teams that came along with the journalists, and to even, in one case that we saw, to go up to physically get really close to a journalist against her will, where all she's doing to do is work, and to keep that distance with her face covering. That is not acceptable. That makes no sense to absorb that. On top of it, within a protest, where, amongst other things, we saw many derogations against public health guidelines. And I'm going to be very clear. It has nothing to do with taking away people's right to protest or to express themselves. It's obvious that everybody can do it, anybody can protest. That's not what this is about at all. But nobody has the right to put everybody else's health in danger. And unfortunately, that is what we were able to see over the weekend. So I find it extremely unfortunate. We cannot tolerate these kinds of situations in as far as we are once again trying to talk about how important it is to keep these guidelines to protect ourselves, because there can be a false impression sent by this group that the pandemic is over, that the virus is behind us, because that's the other thing. Beyond the respect of the guidelines of public health, the message that comes out of these protests is very worrisome. And once again, people have the right to express themselves. That's not at all what this is about. But I find it very worrisome to hear people say that the pandemic is over and that the virus is behind us and that the virus has disappeared. When we look at what has happened, I have neighbors, neighbors like the United States. It proves to us that the virus has not disappeared and the pandemic is not behind us. And we cannot let down our guard. We have to absolutely continue respecting the public health guidelines. And the people who do not respect those guidelines or who express themselves against the guidelines, expose themselves, I'd like to remind you, to tickets on the part of the authorities that would see such behavior against public health guidelines. So this is a reminder, but beyond the repressive aspect, yes, there will be consequences if we continue observing these kinds of behaviors that put in peril public health. And I ask people to show solidarity and to rally themselves to the collective effort. That's what we're doing. And I mean, please think that everybody's tired of this all sometimes of COVID and the pandemic, and we look forward for it to be behind us. But right now, the virus is still dangerous. We still have every day about 150 on average cases, more or less. So that's what it is. It's not over. And the very vast majority of Quebecers, and I'm going to end with that because it's important to remind it, it's still very impressive to see how the very vast majority of Quebecers respect the guidelines, and it's thanks to them that the situation is under control. It's thanks to you that the situation is under control. Yes, we can see our friends, we can travel, we take advantage of the summer as we can. People have adopted the face covering a bit over a week. Most people wear it without any problems, without there being adversity. That is the word that I was looking for. And so in tourist sites, most people behave well. So we're very impressed, very proud of our Quebecers. I'm very proud when I look at all that. But it's unfortunate to see that sometimes a small minority, although it is a minority, sometimes is very visible, very audible. So we cannot let that small minority divide us or take away our attention from what is important, that is to continue protecting ourselves collectively, protect our parents, our grandparents, and the young people. I have made a call out to the young people today, and I would like to add on that. Young people, please take that challenge seriously. You have that power in your hands right now to be able to have an influence on how things will unfold, because you are the most targeted group right now. So maybe it's up to you to put a bit of extra effort so that we can all protect ourselves, our parents, our friends, and all that. So, to the slightly worrisome message that we're able to hear over the weekend, to that minority, very disdainful behavior that we saw over the weekend, let's respond with solidarity and a stronger effort at civism. And I will end by really thanking everybody for having to sustainably, because it's been 3 or 4 months, so that's sustainable adherence to the public health guidelines. Thank you so much, and a great vacation to everybody who is on vacation or who will be soon.
Donc, good afternoon. With the relatively stable numbers of the last few days, we see that the health situation remains under control in Quebec. And last week, we surpassed our testing goal. But we see a worrying spike in contagion among teens and young adults. That's why we're asking young people to mobilize to respect the public health instructions. For your health and that of your loved ones, you must not let your guard down. You have the power to maintain the situation under control. I understand your desire to go out and socialize, but you absolutely have to do so while respecting the instructions. And don't hesitate to go get tested. If you have symptoms or if you've put yourself at risk, go get tested. Screening is available in all regions of Quebec. There are clinics with or without an appointment, and tests can be done day or night. Be proactive. I also want to say a few words about the anti-mask demonstrations in Montreal and Quebec over the weekend. I have to say that I was particularly shocked to see protesters insulting and physically intimidate journalists. This is unacceptable. You have the right to speak up, but you certainly don't have the right to endanger the health of others. We will no longer tolerate situations like this. We have to maintain solidarity throughout this battle that is clearly not over yet. Thank you.
On va maintenant passer à la période des questions. Je vous demanderai, s'il vous plaît, une question.
We will now go to the question period. One question and one follow-up.
Numéro 2. Bénédicte Lebel.
When you say, Madame Guilbault, that you are going to, that there will be consequences, of course it was outside, wearing the mask is not mandatory, but there were people who did not respect. Could you give us more details, examples of what will be done the next times that this something like this happens? Well, we are working on tightening up the repressive measures that we have available to intervene in this kind of situation. We also have to make a difference between, a protest. There were other protests in the past where people behaved very well, and they were, it was on other issues, different issues from COVID-19. But this time it was very different. The very issue of the protest was protesting against, a guideline that we're giving, which is the mandatory face covering wearing. We're all adapt ourselves, but what is sure, we cannot tolerate this kind of situation, like your colleague who was physically encircled and others who had things of a prejudicial nature. So we are talking about it with other government colleagues as well. We're thinking about the way that we are going to tighten up these repressive measures that we want to give them. It's true that we already have some leverage in the present decrees. The police officers can talk about it. We're talking about 2 meters. So if somebody clearly behaves, as I said, in full disdain of the public health guidelines, there are measures that can be taken right now. Yes. Right now, there are already fines. There's tickets that can be given. And that is why I said it. People already expose themselves to these if they behave against the public health rules. But we are evaluating. We had a discussion this morning on that with my 2 friends who are here and other people on the way that we could tighten the repressive measures that we have available for us. With the possibility of a second wave, where are we at? It's a personal question. Do we, in terms of staff, do we have enough staff? Do we have enough PPEs, for example, masks, gowns? Because at the beginning, we remember that is what had been missing, and it played a big role. So before a possible second wave, where are we at? There's a few aspects on your question. On the staffing issue, I think everybody is aware that one of the great difficulty factors was in CHSLDs and the lack of staff. So, of course, with the 10,000 people who right now are being trained and who will be available and who already are now in the practical classes who are going to be available by the month of September, that already for us is an issue that is about fixed. So that is really good news. We have nursing staff, whether it be nurses or nursing assistants, whose work we normally appreciate, who was done in the first 4 months, but who a lot of them are off right now. They're on vacation. So I think what was important was to allow them to rest, and that's where we're at right now. Are things perfect? No, but I think that we have a lot of staff that we are happy that they are on vacation right now. With the calm that we can see in the hospitalizations, remember that we have about 200. That is why we let you know regularly. So, of course, it's calm right now in terms of hospitalization. It allows us to give a break to the staff who really deserved it. Concerning the material, well, of course, we were very, very tight at the beginning, as we explained, but right now, all of our main equipment, whether it be the gloves, the gowns, the masks, and the two kinds of masks, we have from 40 to 50 days ahead of us, and as you know, we made sure that in certain cases, most of these products are going to be manufactured in Quebec over the next few months. So I think that on the question of material, it's no longer an issue. What remains to finalize is to really make sure that we have the best governance possible, and I will get back to it over the next few weeks, the best governance between our teams of CEUS, for example, particularly on the island of Montreal, where everybody wanted to do things well, but that we realized, and we're doing our post-mortem on that, is to make sure that we were going to have teams that work well together. I'll give you an example. And without making too much of a lengthy answer, but we saw in Saint-Jérôme there was an outbreak. And I'm saying it, I think it was really good practice to see how we can react better now with what we call SWAT teams. A team that came from the CHUM, and they arrive with experts. They arrive at the hospital and they tell us, well, listen, there was an outbreak. Here is, with our experience of the past few months, this is how we can help you. Because every time that it took place in an establishment, whether it was a CHSLD or a hospital center, it was often for the local team, it was the first experience. So this governance where we have people come together in this way is new. We've learned a lot from the best practices. The Estrie had done it, the Estrie region had done it very early on, the Eastern Townships. So our challenge is to find what are the challenges for the next part. So if we're talking about staff or if we're talking about that governance, we are working on that, and we are pretty hard toward ourselves. We want to do a post-mortem on these different points to make sure that we limit any negative aspect as much as possible in the next few months.
Ma question est pour Madame Guilbault. Je vais revenir sur l'incident.
I'd like to come back to the incident that my colleague journalist experienced during the anti-mask protest, where she had these two people who came around her and circled her in full contempt of her physical integrity. And now it's filmed live, but it could happen in other contexts as well. So I would like to know, what are the recourses in the case where the rights of a person are not being respected by people who refuse physical distancing? Can we complain to the police officers? Can we start a lawsuit? Well, both recourses exist. She can certainly go to the police, and she could also sue in civil court. But yes, there is a possibility always of doing that. My second question, Mr. Dubé. The government gave itself until the 1st of August to decide how to crack down on those people who refuse to wear a mask inside of public buildings. What are the options that are on the table right now? I'm going to start the answer, and perhaps Dr. Massé will be able to complete. Because remember, when we announced these measures, we had, in fact, said what you just summarized, that we're going to be looking in which way. There's an obligation. I'd like to repeat it, and I want to make the difference between the fines and the obligation. The responsibility is everyone's responsibility, whether it be the retailer, business owner, as well as the person to wear a mask when they are in a public place. So that is a question of responsibility. That is a joint responsibility. What we said at the beginning that was easier when we made the announcement, it was easier to ask business owners to apply it, and that is why we had given the responsibility of the fines on them. It was not an easy choice, but we had to do it in this way. In light of what we are seeing right now, there really is, apart of few exceptions, there really is, on the part of people are wearing it. But if we felt that we have to go up until personal fines, we won't prevent ourselves from doing it. We made a lot of inspections over the past couple of weeks, particularly on wearing masks, and I would tell you that we will not hesitate. We're being very clear today. We will not hesitate in giving fines on a personal basis if people do not respect the guideline in public spaces. And I perhaps would like to ask Dr. Massé to see any other elements. Well, with what happened, for example, what we did with, tobacco or seatbelts, we really wanted social standards to change. We didn't want to have a repressive approach. It's more about telling people that it's a safe behavior for people and people around us, and we want people to adopt it, like the hygiene that is recommended for all contacts with people. That is part of the basic measures. And we wanted to give a period of time where people could have a certain amount of time to get used to wearing it and to not repress them. But you're right. Sometimes there also have to be consequences for people who don't wish to at all, and we're thinking about that right now. So it's not because initially the intention was not that people not be, first responsible, as it was mentioned, but also that those people not be, that they have to answer for their actions. But it's a lot easier first and much more necessary to ask those people who organize these areas to make sure that it is done. We've done it this way in the past. It's always worked well. It really is a minority of people who refuse to accept these behaviors. If I may allow myself to add a point, in that file specifically, we really want to work with the public health teams on a regional level. And I'm thinking here particularly of those on the island of Montreal, because when we have more specific sanctions, and as I said, we'll be ready to go along with certain recommendations that we'll get either from national public health or regionally, to be able to implement those measures correctly, because it's all very good to have measures, but we do have to have the staff to implement it. And that is why over the next few days and weeks, if we saw that we had to go there, and public health authorities, for example, that of Montreal, have to work together. We talked when we announced the first measure, and that we said that as needed, we will go there and we would work together. So I'd like to add that what will happen in Montreal is, of course, going to be very important to have inspectors to be able to do things more easily. And in complementarity, Mr. Minister, as we mentioned, there's over 1,000 promotion agents that were hired by the CNESST to be able to intervene. And there's about 100 of them that are made per day since these measures were set up. So there really are interventions, reminders, messages to people to say that, it has to be done. Those who don't want to, once again, it is a minority. Madam Deputy Premier, I'd like to talk to you again about the anti-mask protesters that we saw over the weekend. Do you have a plan to be able to reach out to those people and convince them? Because, in fact, the message that they seem to want to give is that the pandemic is over, that the mask is useless. Do you have a plan? Yes, I have many masks. That's a good question that you are bringing up, because it's not simple to try to convince people who have such a way of thinking. But of course, everything that we do in terms of, general communication, the press conference like today, a lot of communication on social networks, on our own social networks, we, the ministers, those of the different platforms, the main ones, the places where you can put ads and all that. So, of course, there's that entire general communication plan on the part of the government to try to convince people. And generally speaking, as I said, the vast majority of citizens have gone along with this since the beginning. So we take it for granted that the objectives of communication are in good part reached, in the sense that people have understood. But there is that minority of recalcitrants. And of course, if you heard some of the speeches like I did, it becomes difficult sometimes to answer any rational elements to certain things, because there's all sorts of things that have been said. But I think we have to remind people of the message. We have to repeat things over and over. And, the journalists, when you talk about people who, got sick and have consequences, what people have experienced, it can sometimes gradually bring those last recalcitrants to realize that it's not an imaginary thing, it's not a conspiracy, it's not 5G, it's something that's happening for real in hospital beds. I said earlier on, nobody wants to end up in intensive care. So those people are not immunized against the virus. They could very well catch it and develop the disease and end up in a very difficult health situation. So I just want to repeat that they are human beings like any other person in society, and that they are just as exposed to contamination as other people are. But if they themselves consider that it's not important, their own health, well, then do it for others and avoid contaminating others. Those people have parents, they have friends, they have children. It's for others as well. And I would call out, in discussing with you, I would call out to the people around them, if there's anybody who realizes that perhaps they have a friend or a cousin or a colleague who is part of that group of people who are protesting, well, repeat it, try to convince them. Explain to them that for everybody else's well-being or the team, try to, don't try, just comply with public health guidelines. There are people who say, I prefer not leaving home rather than comply and wear a mask and all that. Well, if they stay at home, and the risk at least is reduced by a lot, but I'm not sure that it's realistic in the long term to think that we just, cannot go out. So the rule is for everyone. That's how it works in public health. If you can't protect yourself, if you don't want to protect yourself, at least protect others and join that collective protection effort. That's how we're going to succeed. That's the only way. It's if everybody is part of that collective protection effort. As far as the tourist regions invaded by people who are not always respectful, they were talking about earlier on, Mégane Melançon du Parti québécois was asking you for a special budget to allow certain cities, for example, in the Gaspésie region, to have safety officers and security agents to not only protect the territory, but the health of the population and the public that lives there. Is that something that you intend to do? Well, I saw, as you did this morning, the communiqué, but we didn't wait for that on the part of the Parti québécois. I've been on that for 4 days with a few of my colleagues from the government. Friday morning, we coordinated a meeting with a few ministries in order to be able to coordinate a government action to support municipalities, amongst them, the municipality of Gaspé that ended up with problems of literally being invaded. Certain zones where camping is not even allowed, there was pollution. And once again, it's a minority. A lot of campers, a lot of tourists are totally respectful and civilized, but they were stuck with a lot of tourists at the same time in places where there were not supposed to be any. So to support those initiatives of the municipality, we have deployed certain efforts. Amongst others, we have added police officers in order to be able to not only support the municipal initiatives, but also to have what I would call a strategic visibility. Because at some point, you can create awareness, and the city has also set up measures, and they've created, groups squads, citizens who became volunteers to go create awareness in people, but there's always people with whom awareness raising doesn't work. So sometimes seeing a police officer walking around, it can make that some people won't have those unpleasant behaviors. So for the past 4 days, we've realized that the situation has improved a lot. We're talking this morning with the mayor of Gaspé, who confirmed to us that things have clearly improved, but we remain in constant communication with them. Now, I just mentioned Gaspé, but it's not impossible that there are other problems in other places, so we're still there to be able to support the municipalities. We're very proactive because, as I said earlier on, we're happy of this mass of tourists all over the place, but it comes with small, specific inconveniences, and we're very proactive to help the municipalities.
François Carabin, Journal Métro. Bonjour à vous tous.
I'd like to come back to the gatherings, 250 people. Certain public health experts are saying that this is like a contradiction, a double speech, because there is an increase in the number of cases, and at the same time, we are going to be allowing, at the beginning of the month of August, gatherings of 250. Are you hearing those criticisms? Why are you still going forward with gatherings of 250 people? If you'll allow me, I'll let Dr. Massé do the first part, and as needed, I will complete, because there are elements that are still not entirely fixed. So, well, first I wish to reiterate that within private homes or backyards, it's 10 and it remains 10, because we know that there is a significant risk of transmission. I know that's not your question, but I want to reiterate that because we do see that it's not always respected. Inside rooms such as this one, when people are wearing the mask to come in and to leave, and that they remain seated and people don't sing, and that they are relatively, quiet, the risk of transmission is very reduced and very much under control. In a lot of European countries that we're using as models, they've authorized that people be able to have that kind of show, to be able to have a cultural, social life, and without risk of contamination if it is done correctly. And we have the evidence that this can be done well inside. So in that case, we have a controlled environment. Where things become more difficult is in outside gatherings. So maybe that's more where the issue is that you are mentioning. And right now, everything that has to do with festivals and large gatherings has been forbidden until the end of the month of August. But we're going to have to see how to talk about this question in order to avoid there being any problems. We talked about 2 meters. Sometimes people respect that, sometimes they don't. And we have to be sure that this is done, because when it's not done, it creates a multiplication of contacts that is very quick and very large. So 250 people inside, essentially something that is very controlled and not risky, and is done elsewhere in public health. That's not what worries us. That is not where transmission is going to happen, unless there's a breach of procedure somewhere. And elsewhere, I think that this has to be looked at and framed. There's work being done about it. And now I will give my mic to Mr. Dubé. No, I think you've answered very well. I just wanted to say that our question right now is a lot more on the outside aspect. In certain places, we may have to specify certain things, but we're still looking at it right now. So by the beginning of the month of August, might be changes. Well, we're on that right now to clarify certain things, especially things that have worried certain people. So we're very sensitive to that aspect. Quickly, I'd like to talk about the upsurge in younger people. Of course, you asked people who go to bars to go get tested. That is, the Montreal Public Health did so. Very often, these are younger people. Could that not explain that upsurge in cases in the young people? And if that is the case, is there a message that should be modified for people close to those people? I'm talking about parents, grandparents. Are we going to have to ask them to go get tested as well? I can answer that. I think that in what the Deputy Premier said, that's also what was said. Because, of course, when we look and we are going to make those statistics available because right now, I would say with the calmer period of the past few weeks, you can see the analysis charts like we are giving you today. We're going to be doing some more over the next few weeks in collaboration with public health. So what we realized in the case of young people, when we look at it per kind of activity, because when we look at young people, we look at an age group, right? When we look at the kind of activity, is it, for example, where there was a lot in work, a lot in health? That's where we had it, but we had very little in a community setting if we go back to 2 or 3 months, whereas now we see that it is in the community. What happens is that it's often the same contagion agents are people who had it or who caught it either in a bar or a private party, and now they end up in a day camp or they end up elsewhere in other activities that are more linked to young people. But it does remain that it is part of the community contagion aspect because those people can contaminate members of their family. So that is why Madame Guilbault was saying that we also have to orient our message so that people understand that most of the time those people I don't do that. A discretion, like a single discretion, sometimes can create that 10 or 15 people over a long lapse of time, and that is what people have to understand. So if you just take like the greater Montreal region, we're talking about 140 to 180 cases per day, but that is on a population that is, 3 million people when you take the entire Montreal region. So it doesn't take much of an error at the beginning to be able to have an effect of what we do see today, like 150 cases per day. So what I'm asking people, and I would like for it to be really clear for the next few days, is that even when somebody realizes that they've made an error, that, they were too close to somebody, and it's normal, we're kind of like, we've got a Latin temperament. Our greatest danger right now is the time that these people take to call us or get tested. And I would like for Dr. Massé to complete on that point, because we have people who very often, when we call them, because we know that they were contacted and probably contaminated, they don't want to answer the phone. And that is when the communication chain gets broken. So that same person who didn't do it on purpose might have an impact. And so, I don't know, Dr. Massé, but you often talk to me about it, especially in the past few weeks. I would like for people to understand that it's not because there was a small error or that, you forgot something, you didn't put your mask on at the right time. It's normal to make that kind of error or transgression. And that transgression can have a major impact on family and friends, and that is where we have to say it as quickly as possible. I'll give you an example of today to illustrate the situation. You have, in a day camp, people who started having symptoms. Is it a child who had it first? Was it a counselor? We'll always have a hard time knowing. But what is for sure is that before people realize the situation, because some people did have symptoms, there are already 20 people who were ill. Now, we identified 27 cases. That was yesterday. It might have increased since then. And those 27 people, taking into account that it was a day camp, were present in most of the other activities. It was a total of 125 children. 250 contacts in total with all the other friends that, friends in Paris that you mentioned. And those people all have to go get screened. It's important because they all had close contact with some of those cases. So it gives you an idea of the speed at which it can transmit. And the fact that, when you have symptoms, and I don't want to repeat what you said so well earlier on, but when you have symptoms, when there's been some kind of breach at some point, well, you have to go, because the explosion can be, or the outbreak can be done very quickly from one group to another and affect a great number of people. And those people can be in contact with people who, as we said, are ill, who may have cancer or other dangers. So you can see the transmission chain. We have to stop it right at the beginning. Once it's started, it's a lot more difficult to stop it. With the example that you just gave, in what region is that day camp, and is that part of the cases that were started or mentioned last week, and it's a prolongation of that? Yes. Can you elaborate a little? It is in the Montérégie region. I'll let them answer because there's a mobile screening unit that is going to go there and join all the people, but it's already been broadcast in the Montérégie region. On the tightening of the non-mask wearing, I would like to have some more specifics. When we talk about an offense report, is it the same thing as the beginning? It's an offense report, so you'll eventually get a fine that the amount we don't know yet. But is this the same thing as the other offense report? Not enough distancing in parks and things like that? Yes, the offense report, I talked about it. So an offense report, without going into too much technicalities, a report is given and then it's evaluated by the DPCP, that is a director of court, to know whether there is a reason to give an accusation. It's penal, so it would be, a fine. So that offense report can be given regardless what the action was. What we did at the time that we made gatherings illegal is that we had given tools to our police officer with something that allowed them to give more, direct fine. And it simplified things, taking into account that there were a lot of interventions that were being done. That tool was also used in bars at the time when we reopened them. There were very few, I don't have the numbers, but very few tickets that were given. Because as I said yesterday, in bars sometimes there were things that were missing, but it wasn't in bad faith. We made a lot of reminders and everything really got set up very well in bars. So all that to say that the offense reports can be given regardless of the rule that was broken. And that goes for, not wearing a face covering. It's also for illegal gatherings. And it will be done. As I said earlier on, we are working at retightening in the sense that, sometimes somebody comes too close, like something that we saw over the weekend. Somebody comes too close, but is still wearing the face covering. So in which way are we going to intervene? Because the idea also is not to become the police that gives everybody tickets. But there are sometimes behavior that is exasperating, especially for the population, the part of the population that does respect the rules. And that goes along as well for private parties. Let's not forget, Dr. Massé reminded us, it's 10 people max in private residences. That is for the inside of your house, but your backyard as well. So there as well, you expose yourself to offense reports. If you're over 10 people, and that people call it out. Police officers are not going to go to people's homes and backyards. That's not what it is. But if, there were events that were exaggerated and somebody called it in, well, people could expose themselves if they have illegal gatherings because they're over 10. And we don't want to get there, and we're almost not giving, tickets anymore. When we look at the data, there were fewer than 8,000 since the beginning of the pandemic, but the past few weeks there's been almost none because we're no longer in that frame of mind. We consider that people do respect the rules, have, joined this collective effort. But if the epidemiological portrait and contagion forces us to crack down again, well, we will have to do it, and that's what I was saying earlier on. Could you specify the amounts that people are exposing themselves to? For the mask is from $400 to $6,000.
Bonjour. Justement là-dessus, parce que
well, on that, because I was looking at the increase for young people in the past 2 or 3 weeks, we've had a lot of discussions with Mr. Dubé about the responsibility of bars. We were talking about the direct link between the reopening of the bars and the increase in young people. Now we realize that with ventilation, private parties perhaps participate quite a bit in those statistics as well. How? You did answer a little, but I want to know how we can control that, because as you say, we can't send the police all over the place to look at, how many steaks are on somebody's barbecue in their backyard. How are we going to do it, and what steps are the ones that you see in order to be able to close down that gap? Well, what we're doing is we're calling out to people's good faith. once again. And when I say people, I want to talk about the age group that we're talking about here, young people. So that is why we are targeting the message for them, because we talked about other age groups at the beginning, it evolved and all that, and very often we're talking, generally speaking, about the public. But now it really is with young people that there's an issue. So I talked to them today, as well as the influencers, all those who might have an incidence on young people's behavior. I want us to all become more aware about the fact that this is what the issue is right now. The fact that parties can be dangerous. And if it's not you personally who's going to develop disease, it might be your dad, it might be your granddad, it might be somebody else in your surroundings. We're talking about the transmission chain earlier on, so it's really important. And we can still be 10 people. It's not about, cloistering yourself all summer long and getting desperate at home. You can be 10 people. 10 people is quite a bit. You can still have fun, with 10 people. But we have to continue respecting the distancing rules. It's one thing to be 10, but we have to be at a healthy distance unless you're with your own family. Or you have to wear a face covering. And let's not forget the basic rules. Wash your hands, wash your hands. We're not talking about it a lot, but it remains the main rule to follow. So it's really important that young people understand the consequences that would potentially be disastrous of contracting COVID-19. If it's not on yourself, it might be on others. And if we don't control the contagion, that second wave, it can bring us to make decisions that would be even more difficult than limiting ourselves to 10 people. That is, to reconfine, to close down sectors of the economy, close down stores and things like that, bars. But we don't want to go there. But if we lose control of the contagion curve, it's this kind of difficult decision that we're going to have to make. We had to close down schools in the first wave and all sorts of things that were unpleasant. So let's weigh it out. Between limiting myself to 10 people and being able to drink my beer a little bit further from my friend, but I can still drink a beer with my friend and, having fun with life, or being confined at home once again and not seeing anybody except my own family, I find that option 1 is a lot more pleasant than option 2. So that is what we have to keep in perspective as well. I'd like to come back to the Gaspésie region. You said that there was an action plan that was in process right now. People from the Parti Québécois also invited you to go and see yourself what was going on. Are you excluding traveling to the Rocher-Percé area? No, I do not exclude it, but for the time being, my colleague Minister of Tourism, it's planned that she's going to go next week, if I'm not mistaken. If it were to be necessary, of course I could go, but as I was saying, I understand that they realized that this morning, but we've been on that for days. This morning we talked about the mayor of Gaspé to make sure that everything is under control. I mean, there's still a lot of people over there, and it has to be said that the temperature makes it that perhaps, it rained and all that, so maybe people are more careful or they don't do as much. But all that to say that it's under control, and if we were to go, we'll go. But between going to visit just to go visit and deploying concrete means to help them control the problems over there. But once again, I think that option number 2 is more interesting for them. And I just want to add with specificity. When I said, drinking beer with my friend, I'm talking about somebody who is, 18 and over, because a minor is not supposed to drink beer because it's... I was talking about the 15 to 34 age group, but for drinking, of course, I'm talking about the 18 to 34 age group. Mr. Massé, you told us, generally speaking, that you were worried to see the increase of cases in the 15 to 30 years of age group. Do we have any more specific data? We're talking about the cases in the past 24 hours. What percentage of those cases come from that age group, for example? We can see here the chart with an increase of 128%. Perhaps elaborate on that data? Yes, but right now, most of the cases that we have are cases that we see between young people who are between 15 and 34 years of age. So in people who are older, it has decreased significantly. In young people as well. So I don't have a specific number that I could give you, but it's the majority right now, and that is what is increasing, and that has been increasing between last week and this week. The past 2 weeks, it has remained relatively similar, but that does worry us because it really reflects a change of attitude that is significant that could be controlled. But I think we'll be able to control the situation. the increase in young people when they start talking about it amongst themselves, when it's amongst themselves that they say, well, listen, it's not okay, it's not good, it's a problem, you're putting me at risk. And I think that we can do things differently. It's at that level. We don't want it to come from the outside. We want it to come from within and amongst themselves. They can do it. We have all sorts of examples where they can say it to one another in other circumstances where they can be at risk. And it's amongst themselves that they can give themselves that message. But it's the majority right now in that age group. Could you reiterate the reason where we can gather 250 people in a public place but not more than 10 in a home? Well, you have to look where we left off, Right now, the only legal constraint, there's a moral constraint, but from a legal point of view, it's 2 meters between people outside. So there isn't a number of people. There are countries that put numbers of people, but we don't have a number of people outside. And we're talking about public places here, not private places. And we believe that with the discussion about the great events, festivals, for example, where there's a lot of very different things that are incorporated in those, if we want to allow those events to be able to get somewhere, we have to be able to give them a framework. So if we want those activities essentially to be able to take place, we have to give them some conditions. And one of the conditions, it's not the only one, but one of them is that we say, well, there is a limit. Do we think that in a crowd of 5,000 people we can keep the rules of distancing? Well, we don't think so, neither do other countries. Perhaps one day we'll be able to, but now, for the time being, we have to start small. And we have to go in things that we can measure and do correctly. So, no, we're not ready to go to 5,000 people. Right now, there isn't that limit. So we have the impression that it's almost as if we're increasing, in reality, to allow certain social activities that are important to be able to take place, that are not authorized. And I think that what we do have to do is to set up these benchmarks. And the 250 is one of the things in our thought process. I'm sorry, I didn't ask you the question. What I wanted to ask you is, there's 250 people inside that is possible. You mentioned it. Why can't we allow more than 10 people then in a private residence? I didn't say it properly. Oh, okay. Well, most private residences, I'll say, I don't have a specific number, but I would say over 95% of residences that are relatively limited, and we believe that inside or outside, it becomes a lot of people within 2 meters. So it's a lot easier to do that than to calculate at 2 meters. And I have to reiterate that within a home, people not only share a restrained space, but they end up sharing bathrooms, utensils, the kitchen, transfer zones. So it becomes not only air contamination, but something that can be done through multiple objects. So that is why we are giving guidelines. We know that transmission in families is done really well. We're talking about community transmission, which is certainly that which is very important right now. The other place where there is an important transmission is intra-family, because there's those very close contacts between people. So the family environment is known as being a place where the transmission is done quickly, dangerously, efficiently. So we really have a constraint there, once again, because we do know that it is dangerous. I wanted to ask you first, quickly, what was the objective for screening that you mentioned? You went beyond the objective. What was it? Was it 14,000? Yes, it was 14,000. And now we have increased progressively the capacity of the lab network to be able to do screening. As you can see, we had a capacity at the beginning that was a few thousand. It went up to 8,000, and then 10, and then 12,000. Now we have a capacity that is close to 20,000, but that is, theoretical capacity, if you will, because we would have the possibility with the machines and the testing of doing that. But now it would be a question of organizing the human resources to go along with that. So yes, we have surpassed it, but we have to keep a certain reserve as well if ever there's any outbreaks to be able to mobilize and intervene in those situations. So we believe that what we have right now is good and it's used correctly if we compare ourselves to others. But if we saw that there was transmission that were to be increasing, well, we'd also have to continue increasing the capacity. If you allow me on that point, what I would add is that not only the number, we're very happy to have had many days above 16,000 tests, and now we're working on having better service for those who come and get tested to be able to, as you saw in the first few days, particularly in walk-in clinics where there were waiting lines, we managed to work on the management of those waiting lines. I mean, it's not perfect, but it's a lot better than it was. And I think that when people see, if they decide to go get tested, there's less waiting area, with less waiting time. There's more places where they can get it. And I think it's going to become a reflex once again. And I insist on that. If people have any doubt, we invite them to come get tested quickly. And if improve the quality and the management of the waiting line, I think people will come and get tested, to have a more normal life and free up their mind. So we're going to work on that aspect of the service. Another question quickly about the bars. It's already been mentioned that they weren't the main responsible ones for the upsurge in cases. It was more private gatherings. But in light of the latest numbers, have you totally put aside the possibility of closing down the bars and things since things are going well, or is it still a little fragile and you're still thinking about it? Well, I would say that we want to keep all the doors open because it's a series of factors. Dr. Massé said it very well. It's young people who very often, and I want to be careful because when we say young people, it's also young adults. We think about young people and we end up thinking about the 15-25, but you have to think about the 25 to 35 age group as well. So that clientele very often are people who will bring the contagion elsewhere. I mean, if you remember the case on the South Shore, these are people who had gone to bars, but who had gone to private parties. And, as we make the link more and more, who end up, doing team sports, it's all the same young people. So I keep every door open. We showed you here per age group, but in the next few days and weeks, we're working together with public health to give you statistics that are regional and a lot more broken down. And to be able to work on the regions and to also be able to work on the kinds of activities. So we are going to try to give more explanations. What does family transmission mean? Or community transmission, I'm sorry, it's not just bars, it's team sports, it's all of that we want to try, that people understand because, and I would like to end on that, when people see our daily statistics of 150, we talked about it a lot, Geneviève and myself, people don't see themselves in those numbers. But if I can say, listen, in the 150 people that we had yesterday, 49 of them were in Montérégie. Well, people are going to become more aware that this is happening where they live. And the third data is it's a transmission that is no longer in a hospital or CHSLD. It's not a foreign worker. It's in your home, in your family. You follow me? So now we're going to try to give statistics that will allow people to recognize themselves and to say, okay, I am part of the solution. And that is exactly the message that our Deputy Premier said today. You are the solution. And if ever you didn't do something properly for whatever reason, call us as quickly as possible because you can avoid significant contagion over for 10 to 15 people. So that is why we need to better explain what we will do, and that will help young people and young adults as well, and we can help them help us.
Deputy Premier, I'm hoping you can answer my first question while repeating something you said in French earlier about young people and how they should not think that they're invincible when it comes to COVID-19. If you can repeat that. But in light of that, my question is, a lot of people would look at these numbers, including experts, and say that this is a reason why the government is wrong for increasing the limit for public gatherings from 50 to 250. What do you say to that?
Yeah, well, first of all, regarding young people, we have to say that young people include people from 15 to 35 years old. So they are not invincible, as you said, and we are observing an increasing of the positive cases among this population, this specific population between 15 and 35 years old. So that's why we are asking them today to mobilize themselves and their friends and people around them to make sure that they respect the rules from the public health and that they influence people around them to do so too, because they have an enormous power in their hands right now, because they can influence the increasing or decreasing of the positive cases among this population. So I am asking all of them, be courageous and face this challenge to embrace this power that you have, respect the rules, influence people around you to respect the rules too, and we will keep the situation under control. That's what's at stake today, is keeping the situation under control and avoiding having to make difficult decisions in the future. So in order to be able to maintain the situation under control, we need young people. So we are asking them, work with us, help you, and respect the rules, and try and getting people around you to do so too. And regarding the gatherings of 250 people, I might let one of my colleagues answer that.
Yeah. Well, we are going progressively, as you've seen, and since that we've opened to 50 people in, those kinds of settings, we haven't seen any outbreaks. This is not the place where outbreaks usually take place. It takes place when people kind of leave the guard, and people are not in situation here in such a room where they are keeping their distances. So this is not the places where it happens really. It happens within families, within groups, within sports area where you don't have any social distancing. So that's why it's really low risk. There's no place where there's no risk, but it's really low risk. And what seems to be something as an increased risk, the increased risk, we are seeing it elsewhere. We haven't had any outbreak in the places that we have opened a few weeks ago now. In other places, we're following that. Does it happen? No, it doesn't happen. It happens in places which are different, and we're taking the experience from other countries where they are doing the same thing. And this is not in those settings where we increased from 0 to 50 and now from 50 to 250. This is not the place where it does happen if people are careful.
My second question.
Maybe as a complement to the first part of your questions, because young people might not recognize themselves in the statistics that we give every day. So it is very important for them to realize that even though they are not at risk of dying from COVID-19, they can have the virus, they can contract the virus, and they can develop to very bothering and painful consequences once they have the virus. So it is very important for them to protect themselves and to protect their family, because if they don't develop the disease, they can pass it to a friend, to a mother, father, grandparents, and those people can develop the disease. And if you talk about a grandmother or grandfather, he or she can be in a very, very difficult situation regarding his or her health, and they can die. So it is important to acknowledge this very high risk when you expose yourself to having the virus. Even if your person doesn't develop the disease, you can pass it to someone else, and then the contamination goes on, and that's how we can lose control of the situation. So I'm really asking all young people to be responsible and to be courageous and to help us sensibilizing other people and respect themselves, the rules, of course.
My last question would be, what can you tell Quebecers right now about what's being done to prepare for a second wave, a possible second wave, and determine how severe that wave is?
Well, we can start with that. First, we're finalizing what we call a post-mortem analysis of what happened in the first wave within the CHSLD, but also I made the point about the the governance of all the different regions, especially in Montreal, because as you know, we have multiple CIS and CIUS that used to work maybe more in silos, and now we need to make sure that we have access to all the resources, because the problem in the first wave happened first in certain region, where some other region, even on the island or around the greater Montreal, they were not affected. So we need, and I gave the explanation earlier, the example of Saint-Jérôme, we learned a lot. 2 weeks ago, we had an explosion in Saint-Jérôme, and we asked the people of the CHUM, a SWAT team, to go and help and assist Saint-Jérôme to make sure we solve it more quickly. That's really something that we've learned from the first wave. And all those things, that's what I call a better or a more efficient governance that will need to be in place, and we're discussing that with each responsible of those CIS and CIUS right now. Other measures will be implemented. I think to one of your colleagues, I answered that at the beginning there was maybe some issues at the delivery of protective equipment. We were saying the equipment was there, but was not always available at the right time in the different establishment. We have increased really an important way the availability of those protective. So many things that we've learned from the first wave are being implemented right now, and we're trying to cover all those points. And I think local management in CHSLD is one issue, because I've toured with the Premier over the last 2 weeks to meet different regions. We've listened to, I'll call that best practices among, for example, in Estrie or Eastern Township, they had a very good governance the way local management was done. So we're learning from all that, making sure that we're implementing those best practices in the next few weeks.
Next question.
Kelly Gregg from CTV. For Madame Guilbault, I think there's an ad campaign now targeting young people that the government's putting out. You've been here, Mr. Legault has been here week after week, urging young people not to go out and kind of be at risk. Why isn't that message getting through?
I think maybe one element of answer is what I previously answered to your colleague, is that maybe young people don't recognize themselves in the statistics and don't realize the risk that they are actually exposed to. Because we have talked a lot about older people who were the people at risk at the beginning of the first wave, and we said that, and the statistics confirmed that those were the people who were really at risk of dying from COVID-19. So maybe the fact that young people hasn't been dying so much from the virus, and that we haven't talked so much about young people having contracted the virus and developed the disease, might have contributed to the fact that they don't recognize themselves in those statistics. But it is that's why it is very important to remind them of the actual risk that they are exposed to, because first of all, they can develop very bothering and painful consequences if they develop the disease. We have seen stories like that. And second of all, if they don't develop it and they are asymptomatic, they can have the virus and pass it to someone else. And that's what is important to explain them. You can give it to someone in your household, or to your parents, to your grandparents, even to your brother, sister, friends, boyfriend, girlfriend, and name it. So, and those people can have very serious consequences. And then you will probably feel guilty and feel that you should have been more responsible and should have avoided illegal gatherings, should have avoided to drink in the same glass as your friend, should have been tested earlier. Don't hesitate, go get tested. If you are in some kind of doubt, was I in contact with someone? Doesn't matter, go get tested. you might be negative and the issue will be closed. So really it is important for young people between 15 and 35 to realize that they are in their own way vulnerable to the virus too, and that they have to get tested to so that we can maintain a portrait of the situation daily and keep the situation under control to avoid consequences for all society.
I do have a second question for a colleague of mine. There was a young person who was killed by police in Lac Brome. She plans to potentially follow up with a lawsuit. But the question more is about the BEI, because I cannot ask you about that certain case. She's frustrated with the BEI about the lack of transparency. This is something they've been criticized for years about. Will there be a change in the BEI and how they divulge information, especially to families?
Well, the BEI was specifically created to regain the confidence of the population regarding the investigations on police interventions, whether people die or have serious injuries in the context of a police intervention. So this organization has been created 4 years ago. It is a pretty young organization, so it is not perfect. There are challenges in this organization as well as in other that are older, but the BEI works the more time goes on, the more BEI gets used to working with their partners, used to investigators in the BEI get better too, because they were all new 4 years ago. So I think as the time goes, the organization credibilizes itself. Can we say that?
Sure.
Credibilizes itself, and we have named a new director in January or February, and I've talked with him. I meet him again this week, and we are working to improve the situation as much as we can, but you have to understand too that the information that is contained in the BEI reports is confidential for much part of it, because they are name of people, and sometimes there are accusations that can be déposé by the DPCP. So for all those reasons, I think it is normal to be very careful in the transmission of information from the BEI, but it is an organization in which I believe, and I think it is a great thing that we have created this independent bureau to make those investigations outside of the traditional police forces.
Thank you.
Next question.
Yes, Jason Magder with the Montreal Gazette. Dr. Massé, I mean, we see the red bar here. People 15 to 35 are spiking with the virus. In about a month from now, a lot of these people will be either students or teachers in schools all around the province. Are you concerned that we're heading to some problems? Are you rethinking your recommendations of how schools are going to reopen, especially if the numbers that we're seeing continue to rise?
Yeah. Well, I must say first that it's been stable for 2 weeks, and we are making all efforts so it doesn't increase anymore, and it decreases first. Second, yes, you're right. It's going to be school opening pretty soon, and it means also college and universities. And we already discussed the measures that should be taken in those institutions where obviously transmission could happen, and they have taken steps to prevent and make all necessary measures. But then you refer also to external activities related with college and universities, and those are things that we are planning and discussing with the CEGEPs and the universities. So we will take care that it's something that's very quiet this year. We might not. It might be quieter entry at school this year than previous years. So we'll have those discussions, and there's also the issue of having a plan within those colleges and universities and schools if there's anything that happened, so that we are sure that people know what to do and react rapidly, offer screening if needed. So if we want to prevent those large outbreaks, we need to intervene very, very rapidly when it starts. So there are going to be messages that will need to be passed. So it's really on our radar, and we'll work with the authorities from schools, college, and universities to do that.
Okay, and I want to also ask you about the Montreal situation. Can you tell me how many tests are being done on average in the Montreal area? And what percentage are positive, and what you can say about the results if they make you more or less concerned?
I don't have the exact figures. I know that for public health, especially, there's 6,000 that are done out of the 16,000, but there's much more in the Montreal region that's done. I'd say most of the tests are done in the CMM area because that's where transmission occurs. But it does happen outside. You have accessibility to tests throughout the province, but the majority is done in the Montreal region. The positivity of those tests is about, yesterday it was 1.4, and it varied from 1.4 to 2% in the last few weeks, and it's been quite stable in the last few weeks. We'd have a small spike about a month ago where it was 3 to 4%, but then we adjusted the accessibility of the test, the availability of those tests, so that it decreased, and we'd say it's kind of correct the way right now it's done. We are not in a situation where we were during the spring, where we had between 15 and 18, 19% of positivity, which is way too high. So that's why we increased quite a bit the accessibility of testing for people. But now between 1.4 and 2%, this is what is aimed by most public health authorities in other places.
And the last question.
Are you
Not to the left.
Can I just, one point on this, because this is very important to complement. I said earlier that today you have this analysis by age, and to your point, we'll have graphs and statistics by region, including how the Greater Montreal is performing, and also by type of activities. The key things is to compare periods with periods, so people can just not only look at the number right now, but how it is evolving. So this is something we're collaborating with Santé to make sure that we gave you those statistics. They are a good example of what we have today, but we'll perform other analysis that will be made public in the next few weeks. Okay.
Good afternoon, Gloria Enriquez with Global News. Before I ask my question, you touched on a lot of topics in French, so I'll ask you to please repeat your statement on drownings and also on tourism in Gaspé, please.
Yes, a really good point. The drownings, it is a very worrying situation that is going on right now. The last number I saw was 55 drownings, maybe 56. Compared to less than 40 last year at the same period of the year. So this is very heartbreaking because every drowning is a drama to a family, to friends, to boyfriends, to girlfriends, so to children. So we have to be very careful this year because they are all circumstances are reunited to maybe explain this higher number of drownings. We stay in Quebec. This is a very hot summer that we have so far. So, and because of the rules linked to the COVID-19, not as much people as usually can go at the same time in public pools. So because of all that, people who don't have pools at home or don't know people who have pools might be tempted to find some places to go swim or to go just freshen up, and they can go in some places that are very dangerous where you cannot go, or you cannot go in the water because it is dangerous, but you don't know it before you actually drown. So it is very important not to go in those places, in lakes and rivers that are not purposely for swimming. And of course you have to wear the VFE, I don't know the term in English, but the the clothing to avoid drowning. You have to know how to swim. If you don't know how to swim, avoid go swimming, or be sure to be at least accompanied all the time by at least one other person, whether you are swimming or on a boat, and avoid drinking too much alcohol, and be very careful regarding surveillance of your children. I spent 8 years at the coroner's office. I saw a lot of drownings, of stories of drownings, and we used to call the drowning a silencious killer, because your child can drown just beside you without you even realizing it, and it takes only a few seconds for someone to drown, and sometimes it doesn't make any sound. So for all that, I don't want to sound too dramatic, but this is the reality of drowning. So because of that, be very, very, very careful and follow the rules that I just listed.
And on Gaspé tourism?
And on Gaspé, yes. It was shocking to see the pictures and to read some informations about what was going on in Gaspé for the minority of tourists and campers who let their trash and in rivers, in lakes, on beaches, on forbidden places to be camping. So I am asking everyone to be respectful and to be civism, so that all people, all tourists, all Quebecers can enjoy themselves in all regions of Quebec. It is a very, very great thing that so much Quebecers are visiting all of our regions, are making the economy roll again in all those regions, and are enjoying themselves in the beaches, in lakes, in rivers, in forests, and everything. But you have to do it peacefully and respectfully, so that everyone can enjoy themselves. And it is a burden for municipalities like Gaspé this weekend, who didn't know how to cope with that kind of situation. So please be respectful, and everyone can enjoy themselves this summer.
Thank you. And now I'm going to ask my question. On Friday, there was an altercation on an STM bus between two passengers after one of them refused to wear a mask, even after the bus driver reminded the person that wearing a mask is obligatory. What should passengers do if they feel they're unsafe while on public transport because someone refuses to wear a mask and also not observing proper distancing, even after the driver has intervened?
It is the responsibility of the exploitant to make sure that people respect the rules. So in that specific situation, the driver asked the person to put his mask, and if someone doesn't comply, doesn't want to wear the mask before he actually enters, or if he takes it off while he is in the train or any other transportation, well, you can call the police, and then the police can intervene to, if you cannot convince yourself, the person, to respect the rules. But you can, you have to, you can, how do you say that, empêcher the person even to get in the metro if she or he doesn't want to wear the mask.
And you mentioned earlier that there could be fines. When can we see those fines, and what is the range of those fines that you're looking into for people who are not wearing masks?
Police forces can give a rapport d'infraction, and those can lead to a fine between $400 and $6,000.
Thank you very much.
Thank you.
Merci beaucoup. Merci.